Welcome, everyone. I think we can get started with today's side event, which is going to be on implementing proposals for global national monitoring of wash services affordability. If you could show the next slide, please. Before we get to the side event proper, I'd like to thank our sponsors, without whose generous support this wouldn't be possible. So that's German Cooperation, GIZ, the Washington Schools Network, and the Osprey Foundation. So thanks to those sponsors. On the next slide, you see that the title of our presentation, which is jointly convened by WHO, UNICEF, and Sanitation and Water for All, is implementing proposals for global and national monitoring of wash services affordability. On the next slide, you can see the agenda. I'm Rick Johnston from WHO. I'll be chairing, and we'll have a welcome from our keynote speaker, Katrina De Albuquerque, the CEO of Sanitation and Water for All, followed by key findings, and then we'll have an introduction to breakout groups. You'll join breakout groups, and then come back to plenary before the wrap up and close. So with that very brief introduction, let me welcome our keynote speaker, Katrina De Albuquerque, for her welcoming remarks. Please, Katrina, the floor is yours.
Thank you so much, Rick, and good morning and good afternoon to those of us joining from a different time zone. I just landed this morning coming from New York, so I still haven't understood what my time zone is right now. It's a pleasure for me to welcome you to this side event on implementing proposals for global and national monitoring of wash services affordability. As you said, Rick, I work for the Sanitation and Water for All partnership. And in my past life, when I was the first UN Special Rapporteur on the human rights to water and sanitation, I must say that in the lead up to the 2030 agenda, I devoted some energy already to this issue of affordability. And back then, I even worked with Guy Hutton on the matters that we are discussing today. And today's event will, as you were saying, be all about affordability. Affordability matters. It's one of the most elemental aspects of water and sanitation as human rights, when we look at them as human rights. At the heart of ensuring affordability is our obligation to ensure that all people, regardless of their life circumstances, have access, obviously, to water, sanitation, and to hygiene. It's an issue of redressing inequalities and achieving the SDGs for all. As our world has been overcome by the pandemic, these inequalities, as you know, have become even more evident. That's why affordability is key to our mission SWA and the key focus of our advocacy efforts. We devoted a whole campaign this year precisely to the topic of affordability. But what do we really mean when we say that water and sanitation must be affordable? And I propose that we look at three main aspects. First one being that affordable access to water and sanitation means that no one would have to make the decision between paying for food, rent, or medicine for their child, for example, or for water and sanitation. And unfortunately, we still see that in many places of the world, or in the majority of the countries of the world, if not in all countries of the world. There are people who are being pushed to make these decisions on a day-to-day basis. Those in the most vulnerable situations most often face the difficult choice between water and other basic needs guaranteed by human rights. And it's true particularly for women and girls who are often the ones managing the household and who see the choices that need to be made. When we factor in their own menstrual hygiene needs, the choices they have to make to have a dignified life are particularly difficult. And let me add something that I just learned like 5 minutes ago, that President Bolsonaro in Brazil has just vetoed a law that had been approved in Congress and in the Senate to distribute free sanitary pads to young girls that were living in situation of poverty, including in situation of homelessness. Number two, affordability and financial sustainability. Affordable, we know that, well, at least I think that those of us here today, we know that affordable does not mean free. It means well-designed government policies and also a balanced and fair tariff system that makes sure that services are adequately priced to those who really need it. And as you know, there was a report by the World Bank indicating, for example, that subsidies for wash benefit the richest 12th quintile and only 6% the lowest 12th quintile. And this shows that there is something profoundly wrong going on, and such practices and misguided policies, of course, contravene our objective of ensuring sustainability. So affordability must be married, must go hand in hand with financial sustainability. And yes, governments have the key role to play here. At the same time, payment for services provides government and service providers with much needed revenue to operate, to maintain, and at least contribute to expanding affordable services that are sustainable in the long term. And we saw a lot of challenges now during the COVID pandemic when certain governments determined will stop doing cutoffs for those people who don't pay without, and I'm not against such measures, I'm just against incomplete measures, without giving them support to providers. How, as you know, many utilities were struggling with ensuring sustainability of services. So affordability and financial sustainability can foster a virtuous circle of affordability and long-term sustainability. And at last but not least, ensuring affordability, this is number three, necessitates an overall appreciation of what households actually pay for water, sanitation, and hygiene. This means we need tools for effective measurement and monitoring of wash affordability. There is important work happening in this regard, but our sector can also learn from other sectors which cover basic needs anchored in human rights. This is a multi-stakeholder and a cross-sectoral endeavor that can only be achieved if all relevant stakeholders are actively contributing and providing their distinct expertise. I'm delighted that so many of you representing different stakeholders are joining us today. Ladies and gentlemen and dear friends, as with everything, good policy hinges on the quality of the information it is based on, and so I welcome this discussion today to help support better quality data on affordability, but also on inequalities, with a view to upholding the human rights to water sanitation. I believe that this will get us a critical step closer to achieving the SDGs. From our side at SWA, what I can say is that we are here to help, and I do wish you all very successful deliberations. Thank you so much.
Thank you, Katrina, for those inspiring words. We can see how affordability is critical for the SDGs, for the COVID response, and for eliminating inequalities amongst different populations. Now, our next speaker is going to present some of the key findings and recommendations from a report that UNICEF and WHO published earlier this year on global affordability with inputs from the GLASS and JMP teams. So I'm very happy to have Guy Hutton, the lead author of the report, take us through the main findings of the report. Guy, over to you.
Thank you very much, Rick, and thank you also, Katrina, for the inspiring words and your leadership on this topic over many years. I'm excited to present to you some of the key recommendations from this report that was launched in the first quarter of this year. It's a very long, detailed report, so we decided we'd just present some recommendations here, and then the breakout room facilitators will dive deeper into three specific topics and questions that we want to cover. And I think my first slide has been well covered by Katrina's introduction. It's really critical that we know, in terms of the financing gap, how we cover those who cannot afford at least the minimum level of service, of wash services, and find ways of targeting them with financial assistance and other financial mechanisms that enable them to make investments in household infrastructure and improved behavioral practices. So I think we should be clear on the why it's necessary. I think we've got to realize that if we don't understand the issue and if we don't have very targeted policy responses, then we will not achieve the SDG targets on WASH. It's a simple and plain fact. This session is focusing mainly around how to monitor the affordability of WASH services. This is based on a 3-year study which involved many organizations. And as I said, we released a report earlier this year which describes our findings. And if you want to access this report, you go to the Pathable platform and you go to the resources or files, and you'll see a web link to both the UNICEF and WHO websites where you can download the report. So the goal of this initiative was to develop a common vision and accepted methodology for monitoring WASH affordability globally for the SDG period and beyond, and to ensure that it has a wide stakeholder involvement. And that's where we drew on SWA, and we also had a dissemination event earlier in the year with SWA partners, and to develop an actionable monitoring plan so that we really have a step-by-step approach with a methodology and resourcing in order to ensure we can monitor affordability nationally and then aggregate to global level. And so there was a long and involved process. We produced a number of country case studies, which are also available on the websites. And we also collected inputs from various conference sessions over the years. And you see which ones we used here. So, one of the key findings really is that measuring actual spending using the cost categories that are typically captured in household surveys, it fails to indicate the affordability issues that might be faced. And I think this graphic shows or illustrates very clearly why this is the case. So this is the example of Ghana from the Ghana Living Standards Survey number 6, where we tabulated the spending on water and wastewater spending for different deciles. So on the left side is the poorest decile, or 1/10 of the population, and on the right side is the richest decile. And you can see that in terms of actual spending, poor people on average spend quite little, maybe 1% of their income in the poorest decile. However, that is because they don't have a proper service, and they use a lot of their time to collect water. So when we access a place of open defecation, and so when you value their time at the minimum wage, then their actual sort of investment time and costs increases significantly to 8% of their income. And then when you factor in what is the service gap and what it costs to close that service gap to give them a basic water, sanitation, and hygiene service, it increases the costs as a percentage of their income considerably for all deciles except the very richest. So you see on the green line, that is what it would cost to meet the basic WASH standard. And then when you factor in the time costs on that, because basic WASH still means families going to collect their water, it increases further. And then if you add the annualized capital costs that are required, not just the O&M costs, there's a further increase. And we see how the poorest households are most affected by these sort of step-by-step adding of different elements of a basic WASH service. So I think this is a really sort of useful and interesting graphic to illustrate the issues that we have, especially in the available data that we have. So I think that I've covered some of these main conclusions. We have low expenditures because often of a low service level. Also these national expenditure surveys don't collect the full range of wash costs. It omits treatment of drinking water at household level. It omits capital expenditures, which are grouped under much broader infrastructure categories. It excludes some of the hygiene costs. And so we need better surveys essentially to collect better data on water sanitation and hygiene. And then the time costs I already mentioned. And there's very major gender and child dimensions to these time costs. We can't just value at a sort of minimum wage or an average wage. There are actually many more issues at stake which affect the sort of most vulnerable populations. We did also, in the report, we showed other methodologies and ways of collecting data. And currently, in terms of global monitoring, there's insufficient data and experience, although with some methodologies such as willingness to pay and utility databases, there's quite some experience, but it's insufficient for sort of sustainable national and global monitoring. We need to strengthen data sources. And finally, some aspects of affordability need to be examined through more detailed country-based studies. The 6 country case studies we reported go a certain way to answering some questions, but in those studies, we only use what data would be globally available through the income and expenditure surveys. And we need to capture more local data sources and to match the policy responses with what impact those policy responses are having on economic access. So I'm just going to go through rapidly some of the key recommendations, and you can find the full set in the report. But the first key recommendation is that we should initiate global monitoring on what households are spending on wash, despite the caveats that I said about the sort of insufficiencies, inadequacies of those data sources. But we do have many countries that have these income and expenditure surveys, and it's a starting point. And if we can then add on the costs that are related to the service gap, then we can build up a picture of what households would have to spend in order to meet the minimum or the basic or safely managed service level. And it's really important to provide key disaggregations. So by service, by water, sanitation, hygiene separately, by service level, comparing basic with a national minimum standard and a sort of higher safely managed standard, and to compare different household categories, such as vulnerable households, poor households, and so on, because it's those ones where we should focus. And we can tabulate the results by cutoffs. So at the moment, we don't have sort of globally agreed thresholds, and that'll be one of the discussions today. So we can show what proportion of households fall in the 0 to 1% of spending, 1 to 2%, and so on, just so that we can see sort of clearly where the majority of households fall. And in our previous studies, we've seen that quite a number of households spend more than 10% of their income on water and sanitation services. So it's important to see where populations fall with respect to these cutoffs. The second recommendation is to explore developing databases on country cost norms. We have very little data, and we also need to understand variation within countries because contexts vary and household situations vary. And we should overlay onto that how these costs are likely to be financed. What is the degree of public subsidy? What is the tariff level? What additional subsidies need to be raised? And also, to what extent can tariffs be adjusted to close the financing gap? And these cost estimates really need to include sustainability, so to make sure these services are sustainable and ensure that they withstand many of the risks, the climate risks, the fragility risks that are now increasingly prevalent. A third and related recommendation is for more detailed affordability assessments. And for that, we need better questions in surveys. We need to target these surveys at vulnerable households, so they can be small area surveys focused on areas with poor access and with affordability issues. We also can promote the building of utility databases, such as what the World Bank has done with the IBNet tariff database. These need to be really a bottom-up initiative where countries get behind the building of these databases. And then we need more detailed country studies on affordability with leadership and ownership by the national authorities. So, of course, data isn't enough. We need to link it to the policy dialogue. And so we need good materials that enable policymakers and other stakeholders to understand the implications of the data. And we can draw on surveys that are done, such as the GLASS survey, which is now being implemented this year, to enable a linkage between the data and the data on the monitoring with the policy responses. Finally, we need to engage in cross-sectoral dialogue. As Katrina mentioned, it's not just about affordability of water and sanitation and hygiene alone. It's about ensuring households don't need to make these very difficult choices between essential services. So we need to work with other sectors, with poverty specialists, and our colleagues in health, in education, and social protection, to ensure that any thresholds that we set are not unrealistic in terms of what should be afforded by households for a range of services. So there's still quite a lot of dialogues to be had, as you see, but we've made good progress, and we're one of the leading sectors in terms of understanding the affordability issue. So with that, I pass back to Rick to introduce the breakout rooms. Well, thank you for your attention, and I'm very happy to engage with you on any findings in the report. Please do feel free to contact me. Back to you, Tom. Sorry, Rick.
Thanks, guys, so much for a brief summary of what's really a very in-depth, comprehensive report. Urge you all to check it out in full if you haven't yet. We now have 3 potential breakout rooms we'd like you to dive into, and the discussion is going to be facilitated by Tom Slaymaker. So I'm handing over the mic to Tom to introduce the discussion leaders.
Thanks, Rick, and hello, everybody. So as you've heard from Guy, we've made a lot of progress in terms of building consensus around what should be measured and monitored in principle. And we also have some recommendations on how those things could be measured and monitored in practice. And what we want to do with these breakout groups is then to dive in and discuss in more detail with colleagues who are online, to get feedback on the proposals and the recommendations, but also to collect concrete examples from different countries and lessons from the ongoing work which many of us are involved in around affordability. So for these breakout groups, we have 3 teams, our discussion leaders, and I'll briefly introduce them. And then in order to help you decide which group to join, I'm going to ask them to make a brief pitch for each discussion group. So the first group in room 1 will be discussing, is it possible to have an affordability threshold for WASH? And that will be led by colleagues Luke Wilson and Alexandra Campbell-Ferrari from the Centre for Water Security and Cooperation. Room 2 will be discussing which costs should be captured. And that will be led by colleagues from WaterAid, Chilufya Chileshi and John Garrett. And the third room will be led by Professor Rob Hope of the University of Oxford and Betsy Engebretson from the GLASS team at WHO. And that discussion will be on what sources of data can provide data for WASH affordability monitoring. So I'm going to briefly turn to each to give a pitch of maybe 1 or 2 minutes to allow you to decide which group to join. I think I'm going to start with Alexandra. You're going to make your pitch for room 1.
Great. Good morning. Good afternoon, everybody. Thanks so much, Tom, for handing it over. This is going to be a very exciting conversation, as Tom said, about whether or not it's even possible to have this affordability threshold for WASH services. For years, we've talked about this threshold. It's varied between 2 to 6% of your income. It's a difficult question to answer, but it's really the key marker of how we're going to determine whether or not WASH services are affordable. So we invite you to participate in this breakout group, and we're really excited about getting your opinions, thoughts, and feedback. Hope to see you there.
Super, thank you. So that's room 1. Room 2, Chilufya, would you like to make a pitch for room 2?
Yes, thank you. Yeah, so in room 2, we'll be focusing on which costs should be captured. So I think you will recognize that there'll be several costs that households have to bear to be able to access WASH services. Some of them are immediate, quite visible, and more frequent. Some of those recurrent costs, such as the cost of paying for a liter of water or a bar of soap to have full hand hygiene practice, or using a public toilet. And others are much less visible, sometimes long-term, less frequent capital costs, and households interact with those kinds of costs slightly differently. But there's also additionally those non-financial costs, and how should those be captured? How should they be captured? So I think we'll have a good discussion in this group, and hope you join us.
Thank you very much. And last, but certainly not least, in room 3, Rob, over to you for a quick pitch on topic number 3.
Thanks, Tom. So the triangle. So quite nicely, if you don't have this information, the sort of policies and things will be potentially misleading and not get us into the right place. So what we're going to be concentrating on here, what are the data? Oh, and how we can sort of understand that more clearly. Pass it back to you, Tom.
Okay, thanks, Rob. And your audio was breaking up slightly there, but I think it's very clear from the slide. So this will be about the data sources that can potentially provide information on affordability, and understanding where those data are potentially going to come from. So what we're going to do is we're going to take 30 minutes for these breakout groups. Your team leaders will facilitate the discussion, and then we will all come back to plenary for some feedback on what you've been talking about. 5 minutes before the end, you will receive a warning, and then 1 minute before the end, there will be a timer telling you, counting down until you will be brought back into the plenary. But with that, I hope you enjoy your breakout group discussions, and look forward to seeing you back in plenary in 30 minutes. You should be invited now to join one of the breakout rooms, so take your pick.
If you do not see the pop-up window to give you the options for the breakout rooms, you should be able now to unmute yourself and tell me which breakout room you'd like to have.
Hi, this is Rolf. Can you put me in group 1, please?
Anybody else need to be sent into a breakout, helped into a breakout room?
Yeah, hi Elizabeth, this is Betsy. Could you put me in group?
If you're still in the room and you're unable to select a breakout room, just unmute yourself and I will help get you where you need to go. Hi, Edna, I see you're still in the room. If you need help getting into a breakout room, just unmute yourself and let me know where you would like me to put you of the 3 breakout groups shown on the screen.
Hi, I'd like to be in group 3, the room 3, please.
3. Hi, Kai. Indy, I see you're still in the room. If you'd like me to help you get to a breakout, just unmute and let me know which one to send you to. Oh, hi, Cameron. I see you just joined the room. Our folks are all in breakout rooms right now. If you don't have the pop-up to head to a breakout room, just unmute yourself and let me know which room you would like me to send you to. Hi, Cameron. If you would like to head into one of the breakout rooms, I can help you get there. The 3 rooms are shown on the screen. If you'll let me know which one you would like, I can direct you there.
All right, checking it out here. Yeah, if I can go to room 3, that'd be great.
What data sources? All right. Hi, Kahinde. It looks like you are not able to join with muting and unmuting. So I'm not sure. Well, never mind. Hi, Matt. I see you. Oops. I see you've joined the session. Everybody's in breakout rooms right now. And if you're able to see the 3 options on the screen, you can tell me which one to send you into.
Hi, I'm just stepping in, probably stepping right back out, so I'll probably just step away.
Okay,
Appreciate it.
so don't send you into a breakout room?
Yeah,
All right.
that's fine.
Okay.
Thank you.
You're welcome.
Bye-bye.
Hi, Leslie. I see you've just joined. Everybody is in breakouts right now. If you would like to let me know which breakout to send you into, you should be able to unmute and I can direct you to the room you'd like. Hi, if you are just now in the room. Hi, Edna and Millicent. Everybody's in breakouts right now. If you would like to unmute yourself, I can direct you into a breakout if you'd like to join.
Yes, I'd like to join.
Which room, 1, 2, or 3?
Two.
Is this Millicent?
Yes, this is Millicent.
All right, you're on your way.
Okay, thank you.
Hi, this is Edna. I'd like to join room 1, please.
Sure. Hold on just a moment. You're not showing up on my list. I might need to refresh. Give me just a minute.
Okay.
It is not allowing me to select you. Did you have any problems getting connected to the session?
No, I didn't. Not when I first joined. Should I leave and come back again? Does that help?
Hang on, let me try one more time. Yeah, because every time I open it to try to move you, your name doesn't appear on the list, so I'm not able to grab you.
Okay, let me leave and I'll come back in.
Okay, I'm sorry.
No problem. All right.
In room one, we were going to get feedback from either Luke or Alexandra on just a brief summary of the key points that came out of your discussion.
Great, thank you, Tom. So we had a fantastic conversation. I think it's difficult to summarize, but I'll try quickly to just go through some of the key points that were made. You know, one of the key points that was made is that there's a difference in the expenditures and access to income between the rural communities and urban communities. It's unclear as to how those, you know, how much of a difference there is between those two communities, but that is a consideration that was brought up. There was a question raised about, you know, other measures besides income that we can consider. Also the seasonality of access to income, that there are households that have access to income for maybe 3 to 4 weeks, and then they lose that access to income for the next 3 to 4 weeks. So how do you consider that seasonality of income throughout the year? There was some discussion on the kinds of rates that can be charged. So suggesting a lifeline rate, which helps to alleviate some of these issues in general by reducing the rate for qualifying lower income households. There's also a discussion of a mention that the y-axis on, if you remember the slide, that there's some greater flexibility in the y-axis in terms of you can access surface water, or if you can access surface water for certain daily tasks, and then get access to drinking water that is safe and properly treated for your drinking needs, that also helps to counterbalance some of your need for greater water through that drinking, or that meets that drinking water quality. Also, we started to have a discussion about the poverty basket in general, and starting to collaborate with other sectors in terms of how do you provide these basic needs and basic services to lower income households. By the same token, you know, water is absolutely essential to survival. And so there was also a point raised that it should be the priority issue that we focus on. And so what does that mean? You know, how do you collaborate with other colleagues, especially when the water sector is not necessarily prioritized in the poverty conversation, and when it's not prioritized in general in terms of government budgets and other discussions. So how do you keep the spotlight on water access and consider this broader need of other services as well? And then I think that is essentially it. So thank you so much.
Okay, thanks, Alexandra. And I'm going to move to the other groups as well for a quick summary, and then I'll ask anybody else if there's anything to add or any points you've just thought of. But in all cases, I think, if possible, we want to really identify those examples of things that are being done at a country level that are really promising in terms of efforts to measure and monitor affordability. So if any of those came out of the groups, please do let us know so we can follow up.
Tom, you've somehow become muted.
Rick, could you just flick the slide to room number 2? And I'd like to invite either Chilufia or John to feedback on that breakout group.
Thanks, Tom. So let me start, and we had a good discussion around the different costs which have been identified in the presentation on water, sanitation, and hygiene. We thought about recurrent costs, which are generally more immediate, capital costs, which are not as frequent, but then can come in at much higher levels, and also the non-financial costs as well, in terms of where it's not so easy to put a monetary value to them. And I think where we came out was that, for water, sanitation, and hygiene, recurrent costs, capital costs, non-financial costs, they're all critical. That's not to say that it's easy to get information on all of this, but I think there was a recognition that all of them are very relevant for households and understanding affordability. And so certainly in terms of the approach, we should be trying to really grasp what's happening in each of these different areas that were highlighted in the table. I think also we highlighted the fact that that sanitation is an area where perhaps this is under prioritized, in particularly rural sanitation, and if we could get a better understanding of the affordability problems, challenges around rural sanitation in particular, that this could help drive some of the change and start attracting the finance into the sector, which is needed to improve access levels. In terms of, we didn't manage to discuss in as much detail the which WASH standard should be assessed, but I think essentially the view that this could be assessed and the cost of these could be looked at, and then can be considered against the different deciles. So I think again, we were thinking that basic, obviously crucial in many contexts to understand that in terms of the affordability question, but also safely managed too. So really, depending on the context, we thought important to consider these different standards. In terms of gathering the data, I think we recognize that actually building a global database on this is going to be a huge contribution to the sector generally. And I think this report has really helped begin that in terms of the recommendation. But the types of issues, for example, how basic inputs like cement might be very different. The costs of that may be very different in Africa compared with, for example, Asia. And so again, to sort of get to grips with affordability, it's really the benefits of having a global database were highlighted. And also in terms of gathering information, how potentially WASH household diaries, could be an additional complement to some of the existing sources that we know about, existing surveys, etc. And so all of that can, that could be a really sort of good insight into the types of affordability issues which different households and different communities are facing. So overall, I think we recognise the importance of really trying to sort of improve the data that's available on all these different areas of costs: water, sanitation, hygiene, recurrent, capital, and non-financial. So we considered them all to be important, and saw this report as as having taken a big step forward. Back to you, Tom.
Super, thanks, John. And I think that the point you highlighted there about a global database on costs having value in its own right, not just for affordability, but having huge value for other discussions in the sector, I think is really important. But it's a huge piece of work to start to develop that. So let's keep thinking about how we can move forward. And last but not least, room number 3. And I think for room number 3, we're going to have Betsy report back on the discussion in the breakout.
Thanks, Tom. Our group, we had a really interesting discussion on data. First of all, we looked at sort of what type of data. Are we looking at just household expenditures? But then there's more nuances within that. For example, women who are going to work, do they need to pay to use the restroom during the day? How much does that cost? And some of the research coming out of our group was saying that that's actually very substantial costs. So that feeds into affordability. And then there's also the issues of, if you're doing household surveys, maybe the households don't own the infrastructure, so you need to talk to service providers, utilities, or landlords. So who are we asking the questions to? We also looked at some of the challenges surrounding data collection. For example, we don't have standardized questions about affordability for households, then we have to think about who's doing the surveys, because there's not a single global household survey looking at affordability. And then also with some of the data sources, especially from service providers or local governments, they're not necessarily publicly available. And so there's a lack of transparency. And then finally, we also looked at how different data sources can work together since there isn't a single global one. We talked about how global monitoring, such as what GLASS and JMP are doing, how that can fit in with occasional research that is happening, so how you can triangulate the data. So it's a very rich discussion. We didn't come out with specific data sources that we could use, but talked more about how the different types of data collection that is happening, how they could all work together. Thank you, everyone.
Thanks, Betsy, and that's a great summary of quite a detailed discussion. I think what we had there in the breakout groups was really nice, because there's so much sort of knowledge and experience out there on, and a lot of people thinking about this in different ways and experimenting with different ways of collecting information, which we can potentially draw on and hopefully start to compile, harmonize and standardize under this initiative. But it's a huge piece of work, and so it will take time. I can see a couple of people are typing in the chat additional things that weren't mentioned in the summaries. But is there anybody else who wanted to raise any critical issues or interesting examples before I pass back to Guy to wrap up the session? So there's a point from Chilufia about the importance of also capturing the opportunity costs. What are households giving up in order to be able to afford WASH services? I see Rick Johnson says, touched on the idea of using water diaries as an interesting potential data source. I think that came up in a couple of the groups. Any other final points before I pass back to Guy? Okay, well, thank you very much. And we've recorded all of this, so we will be taking detailed notes. But in the interest of time, I'm going to pass over to Guy to wrap up and close our session. Guy, over to you.
Thank you, Tom, and thank you to everyone for your inputs, especially the facilitators. I think that what we've sort of discovered over this long journey of sort of the deep dive into the issue of affordability is that we've achieved quite a lot of clarity. And I think that the report does sort of show the progress we've made on the sort of concepts, but it's still not totally clear. It's still quite elusive. The deeper you dive, the more you realize there are sort of sub and side issues that you've got to deal with, such as whether you try to capture capital costs into the equation, because the 2 to 6% is typically looking at O&M costs. So how do you deal with capital costs? And I think in the end, how you measure affordability will depend on what data sources you have and how robust they are. And many of these will be very context specific within a country. They may be a research study, and then we have to look at extrapolability to the nationwide context. I think one thing we can do, and it has been mentioned, is to highlight how current subsidies are distributed, allocated very unfairly if we're looking at who gets them. And that is because existing systems get the subsidies, and those who are left to sort of fight for themselves are not sort of registered, or they're informal providers. So I think we can do more to draw on the results of the World Bank report mentioned on subsidies, but also get more country case studies and make the case A point came up about sort of how do we separate water, sanitation, hygiene, because they're sort of three different components. I don't think that we can necessarily expect to allocate a fixed percentage of the household budget to each of them, because they have different relative costs in different contexts, and households have different needs according to their sort of their structure, their demographics. I think that's another issue we have to sort of try and address and provide some guidance on. So in terms of next steps, I did go through the recommendations of the report, and I think concretely there are some things that we are sort of planning already. One is to produce by the end of this year a detailed methodology guide for how a country can do a complete affordability assessment with a menu of options, understanding that different countries will have access to different data. Secondly, to engage with countries sort of from the global level to sort of encourage, motivate, even help provide technical assistance, so that we get some more case studies and we prove the utility of measuring affordability and the connection with the policy response. And of course, we should link with other initiatives such as GLASS and TrackFin, that's the Tracking Finance Initiative of WHO, to ensure that all these data sets sort of speak to each other. Also, we want to encourage partners, including those here on the session, to incorporate WASH expenditure in surveys such as baseline or endline surveys that you do in your projects, so that we have more data and that you can also consider it in the implementation of your own projects. Finally, to initiate this global assessment where we can pull together the data sets that we have available from countries, like we did in the 6-country case studies, and start to build a sort of regional and global picture where possible. This, of course, needs resources, and the Affordability Initiative is not separately funded by under GLASS or under the JMP. So we need to certainly resource this initiative in order to implement these many good ideas. So well, with that, I want to thank you again, and hope that this conversation will continue. And please do get in touch if any of these recommendations inspire you and you want to work with us. And again, thank you to the sponsors of our event, without which this session wouldn't have been possible. Thank you, and I think we bring this session to a close. Goodbye.
Thanks, everyone. Goodbye. Enjoy the rest of the conference.